Okay, so we're home helpers here doing our water cooler chat. I'm Daphne, and I'm here at Bradenton Health Care with Alejandro, the Executive Director, and we've got Paul with Genesis. He's the Director of Rehab, and Benjimen Weidman, he is Social Services Director. So, welcome everyone, and we're going to start off with Alejandro. Tell us a little bit about your challenges here at Bradenton Health Care. Also, we'd like to know some of your accomplishments and goals for the future.
Well, to tell you a little bit about our building, we're a 105-bed facility. Approximately half of it is long-term care, and the other half is short-term. Our long-term care does include our memory care unit. It is composed of 18 beds. This time it's only females. We do have some openings right now. We offer services like physical therapy, occupational, speech, skilled nursing, wound care. We're able to take care of trach patients, dialysis. Some of the challenges, definitely COVID, like everyone.
Yeah,
COVID-19 hit us really hard last year. And yeah, we're rebuilding our census and our building again. Staffing definitely a challenge as well, like everywhere else. But it's also an accomplishment because it is very rare to find a facility that does not use agency for staffing, and we're one of those who do not use agency for staffing. And with that, of course, we're able to provide that continuity of care by having our own staff. Some of the other accomplishments would be we have been able to maintain a 5-star rating.
Wonderful. That's great.
And that takes into consideration quality measures, health inspections, and staffing as well.
It's pretty amazing, actually.
It is hard to keep it up every quarter, it changes, so it definitely takes a lot of work. What the goals that I have for us as a team with building is, of course, to keep providing quality care for our patients and being able to be an advocate for our residents and be a support in the community.
Those are all very important things, Alejandro. Okay. Well, based on those services that you mentioned, which one would you say has the most impact on our community?
It's really hard just to pick one of them. It really depends on the need of those families out there. Some of them might consider memory care. It is hard to take care of a loved one that has dementia. Wound care, but I would say one of the greatest outcomes that we have is therapy. This is why I asked Paul. He's been with us in this building for 14 years. So I'm going to let him talk a little bit about physical therapy, occupational, and speech.
So my name is Paul. I'm a speech pathologist. I work for Genesis Rehabilitation, and we are the therapy company that provides all the therapy in Bradenton Health Care. Like Alex was saying, I've been here coming up on 14 years with the building. And most of my therapists that I have working for me now have been with me for almost that amount of time too. I hired almost all of them when I first started, and they're still with us. So the tenure for the therapy here is anywhere between 12 to 14 years, which is really unusual in the therapy business to have the same therapist working in one facility for that long. I can't say enough about my therapy crew. I would trust them with my own parents. They do an excellent job, very conscientious, and they really know their stuff. Each one of them has 20 years plus experience as a therapist. We do a great job at getting people rehabilitation in order for them to go back to the prior level of living. That's always our goal. We want people to be able to go back to their prior level, if not even better sometimes. With our therapy and strengthening and techniques that we show them, we've discharged many people that actually function much better when they go home from us than they did even prior to their hospitalization. Like I said, we do offer physical therapy, occupational therapy, and speech therapy. Therapy is offered 7 days a week. We do have therapy here every day of the week. It'll depend on the physician's orders, how much we give therapies. Anywhere from 3 times a week to 7 times a week, depending on how aggressive the physician wants to be, and depending on the insurance. Some insurance mandate a certain amount of therapy. So, and recently we have won awards for Genesis for the state of Florida for their outcome awards, which means that our therapy department reached the highest functional outcomes of our patients as compared to when they were admitted to us, as to when we discharged them home, or to assisted living, or to wherever the prior level was. Our therapy team was able to obtain the highest level of function out of our, at that time, it was 112 buildings in Florida. So we were able to be the top of that and do the best for our patients to get them home at the best functioning ability that they're able to be. So I love this building. It's my second home. I've been here for a long time now. And I can't say enough about the therapy department and you know, how well we get people up and moving and get them back to what they need to be doing to go home.
Well, it sounds like you're doing top quality work here. That's very important. Well, Benjimen, we turn it over to you now. What can you families expect when they're choosing a Bradenton Health Care for whether it be short-term stay or long extended stay? You know, short-term meaning rehabilitation, or forever home here?
Well, I think the thing that Bradenton Healthcare has is that, you know, we're part of a larger group of facilities as well, Consulate Healthcare, and there are some core values that we have. We focus on compassion, honesty, integrity, respect, and passion. So we really only look for those staff that have that drive to really care and treat the people that come here like their family. It's not unusual for you to see one of our CNAs buy one of our gentlemen a Coke for lunch on a daily basis.
Yeah.
So I think that's what families can expect. When you walk through these doors, you become part of who we are. We treat you the same way we would treat a family member. Even staff, we work together as a team and as a family unit. We function that way. My personal experience here, I moved down without any connections to the area. I got this job off the internet, did a virtual interview. I jumped right in when I got here on the 12th of April, and I melded right into this melting pot that we have here. We are all so diverse, and we all bring something different to the table, and that's exactly how we treat anybody who comes here. Every single person is an individual, and every single person brings something different to our environment and to our building, and it just makes it that much more fun, that much more interactive. And families can expect great communication from us. We truly want the best outcomes for everybody that comes here. And you can also expect honesty, which is one of those core values. When I sit down and I meet with families, it's about what the realistic expectations are. I'm going to tell you what the realistic part is. I'm going to say that I'm going to hope for the best in dreams as well. And we're going to meet in the middle somewhere most likely. And that's what I love about this field and what I love about this building and this facility is that when it comes to those core values of compassion, every single person that walks through these doors has compassion and gets compassion in return. And every single person is honest with each other. You know, we are human. We all make errors, and we all have judgment calls. We own them. We're honest about that. But we'll work with you to resolve it and create some sort of system that fixes that. Having integrity. I mean, who doesn't want someone to work for them and provide them the highest level of care that owns what they do? That's huge.
And I think most families are looking for that authenticity from the place they choose. So that's really important. Well, they all sound like very important components when choosing a place for their loved one, whether it be short-term or long-term. Do we have any final thoughts from you, Alejandro?
I mean, like you just said, there are components to having mind, which is home. My best recommendation to those families out there looking for a place is tour the buildings and use nursing home compare. That is the true one indicator whether they have good outcomes.
So what's it called again?
nursinghomecompare.gov.
nursinghomecompare.gov. So when you're looking for a place, nursinghomecompare.gov. That's a very good recommendation. All right, guys. Well, thank you again for allowing us to come here and visit. And if you're looking for a great community for your loved one, whether it be short-term or long-term, consider Bradenton Health Care. That's all for now for Water Cooler Chat. Take care.
Thank you, Daphne.
Thank you.